Nikki Olson. I am a licensed clinical mental health counselor. I started getting trained in MBB about 4 years ago when I went to a domestic violence training and learned about it from there. And I was certified shortly thereafter, and I've been using it pretty much solely in my practice since that time, so for about 4 years since then. I really like the fact that our clients, we don't have to fix them. They're not broken, they're not damaged, and that we can kind of come up with this common language that we can kind of understand to work through some of their things that are holding them back from functioning the way that they want to function. I'd say the people that are wanting to learn MBB or know nothing about MBB is that you don't have to have anything wrong with you to be using mind-body bridging. I always tell people that these are practices and skills that anybody can use and benefit from on a daily basis, and they're just good life skills to have, to know how to function through kind of the day-to-day turmoil that we all have. I'd say this modality for other counselors is something that pulls from a lot of different aspects of other modalities and really streamlines to getting to talking about what we really need to talk about in a session. It doesn't involve a lot of work on the therapist part. You really put the work back on your clients and helps them to really be in charge of their own session. And you're just there as a guide or someone that's just walking them through how to use these skills. So it's really something that's kind of eased a burden in my therapy practice, and I think it would help a lot of other therapists.
My name is Andrew Stuck, and I'm a licensed professional counselor over in Southern Oregon for a community mental health agency. I've been using MBB in my practice as well as personally for the same amount of time, which is about 2.5 years now. And I actually just recently got certified as a certified mind-body bridging practitioner about 3 months ago. So I've sunk in from day one and ran from there. Actually, MBB found me. One of my closest friends and mentors, Dirk Shumway, moved to Oregon, and he's actually a direct student of Dr. Block's. And he and I met up because we worked in the same agency, and I was struggling with some, say, fatigue, burnout, the stuff that people normally struggle with, especially clinicians in the community mental health world. And he just did a map with me, and I was like, what is this? And he taught me it, and that was 2.5 years ago, and here I am today. It's just simply the fact that it's so simple. It's really accessible to anybody that I work with, and I don't have to try and sell them on it because it's an experiential model rather than something that we're trying to think about. And so all I got to do is lead them through the practice, and they get to feel the shift for themselves. And then basically my work's done. It's just supporting them in that practice and allowing them to shift from a non-effective system to a more effective system. And they get to feel the benefits immediately.
My name is Beth Adair. I am a therapist and also a social worker with the Division of Child and Family Services, working with investigations. I first came across mind-body bridging as a part of my master's program at the University of Utah. It just really resonated with me and really kept me going throughout that semester. And that was my initial introduction, and I've been sold on it ever since. And I use a lot of the mind-body bridging practices with the caseworkers there who are professionals. I've taught a few courses on mapping and thought labeling and sensory awareness and how to use that as a part of their job as a professional. I also have introduced it to clients as a part of my clinical practice as well. I would say the most useful thing about mind-body bridging is that it really connects to people in a way that is personal to them. So everyone experiences it just a little bit differently. And because of that, they experience it in a way that's useful to them, or at least they can if they're open to it. And I think that not only is it helpful for professionals, but it's helpful for our clients and the people that we work with. And I've just seen it be really adaptable in every situation and really help people, including myself, to adapt and work in situations that can be highly stressful.
My name is Katie Fortenberry. I'm a licensed clinical psychologist in primary care. I've been using MBB for about 2 years since I've been certified. I use it very frequently, both in my practice and also in my teaching. In primary care, I'm usually able to see patients for very short visits. And I find MBB useful for helping them to very quickly understand how they can help themselves to calm down and get into a better mental state. In my educational role, I teach physicians different psychological and psychiatric skills. And I've been using MBB to help the physicians to recognize when they're in a state of mind where they might not be making the best decisions, and to be able to come to their senses and get into a better state of mind where they can really be present with their patients and be able to do the best jobs that they can. I've really enjoyed using MBB in my practice. I want to be able to maintain my certification and be able to take this to the next level, hopefully be able to teach others how they can practice MBB too. For other people who are interested in learning more about MBB, I would say that this works. Once it clicks, it changes your life, it changes your practice.
My name is Josh Dowdle, and I'm a licensed clinical therapist or licensed clinical social worker, and I work for the Utah Department of Corrections. I've been using mind-body bridging for about 3.5 years. I really like using mind-body bridging in a group setting. I use it individually, but I also use it in group. But it's amazing the interconnectedness of people once they, are able to rest that identity system and are able to start to connect with each other, and being able to kind of feed off of other people and how other people are responding to mind-body bridging. And what brought me here today was, one, I really wanted to meet Stanley Block. I've been a fan of his for a few years now and was really excited to meet him. But also to kind of learn where mind-body bridging is going, if there's anything that I'm not, full understanding of, and being able to kind of better my practice. What I would say to those that want to learn more about MBB is to really explore it out. Any avenues they can find to learn about mind-body bridging, whether it's meeting with a therapist who's already experienced in it, or like getting one of Stanley Block's books that he's written. Mind-body bridging is absolutely amazing. In fact, I tell all of my clients, I wish I could show mind-body bridging to everyone in the world. I wish everyone in the world would know what mind-body bridging is, because of what it's done for me and what I've seen it do for my clients is absolutely amazing. And to see the transcendence from where you begin before you understand mind-body bridging, and then where you are after you understand the concept of mind-body bridging and how to apply it. So I would just highly recommend checking it out.
So I have been using MBB since I graduated with my Master's of Social Work. It was about a year ago, more or less. And I started my kind of training and certification. I just finished phase 2 of training. And so yeah, it's been about a year of using it more, of really integrating it into my own personal life, and now I'm starting to go into more of that professional. Most useful aspects of MBB for me has really been the awareness I get and I receive from softening or diffusing those requirements, freeing up my natural functioning so that I'm able to participate more effectively in my life. The practice itself is super instrumental in responding rather than like a reaction to things, stressful things in my life or in professional settings, but to just like function how I know I can, or and it feels good to just do that. So I think in general, the practice itself of these tools to really diffuse requirements and free up natural functioning, as a whole, that's the most useful part. All of it, really. I'm using it professionally, and in that sense, MBB provides a really wonderful lens through which to experience what my clients are experiencing in their life, and to have a different perspective on how I can assist them in navigating their world, with integration of MBB practices, but sometimes not. Like if it's not clinically appropriate for my first grader or my kindergartner to integrate some of these things in a strictly MBB way, but it provides me a really wonderful lens. So I am a school-based mental health professional. I'm a CSW, and I work as a partner with an elementary school, middle school. I also have some high school clients as well, so that's kind of primarily what I do. I do some work with an adolescent day treatment facility, primarily for adolescents who participate in maybe some self-harming activities or other unsafe behaviors. And so I'm actually using MBB, running groups, weekly groups with that adolescent population. And then with my individuals in the school setting, I get to do a little bit of incorporating these MBB practices as I see clinically appropriate with some of my kiddos.
I'm Braxton Dutson. I'm an LCSW and certified sex therapist. So I've been using MBB for the past 2 years in my professional life as well as in my personal life, ever since going through the certification program. I really enjoy using MBB in the capacity of working with individuals and couples. The majority of the people that I end up using it with tend to be couples that are having a lot of distress in how to communicate, especially when they aren't quite sure how they can get through fights or disagreements. I also work with individuals who tend to have a hard time with dealing with pornography, anxiety, depression. And the majority of my clients I tend to use with, just right off the bat, is to develop coping skills or different ways to deal with distress in everyday life. So I think the most useful thing for me in MBB is the ability to notice the body tension when it occurs and allow the body to communicate with my mind as I use it personally, and allow for the individuals that I work with to start recognizing, wow, my body changes, and this is a way for me to recognize I'm getting stressed, I'm feeling depressed, I have a requirement that's not being met, and I don't need to react in a certain way. I can rest that and identify what's going on in the situation instead of feeling like I have to react a certain way. So that feeling of control and taking back your ability to make the decisions that you want to make instead of feeling like you're just at some addiction or that you're not able to make the decisions for yourself.
I'm Chase Wickersham. I'm an LCSW in private practice. I started the Kaizen Center for Mental Health. So in my personal life, I've been using mind-body bridging for probably about 4 years. And in my professional life, 2.5, 3 years. The things that I've found most useful about mind-body bridging, personally is experiencing mind-body bridging, is experiencing the identity system through not just writing about it, but when I did my first map, I wrote it down, and just free writing for a couple minutes in a map was just a very different experience of mental health for me. And using bridging as a practice to rest the identity system through sensory awareness, and continuing to use that on my second map and really seeing what it's like to rest the identity system as I do a second map. I just never really experienced anything like that. All my therapy before had just been talking, and then I've noticed the same thing in my professional practice, that clients have similar experiences to what I did when I first was a patient. Yeah, so professionally I've used mind-body bridging in inpatient treatment setting for addiction, partial hospitalization program, intensive outpatient program for addiction, individual therapy for addiction, anxiety, depression, trauma, anger in adult individuals. And really there's just a lot of broad application for its effectiveness. The eye system being overactive can manifest itself in all those different things I just mentioned: anxiety, anger, addiction, depression, trauma, PTSD. So I've really found it a versatile tool that I can rely on for a variety of clients and problems. Getting regular training is crucial. It's one thing to take a class for a semester and to buy a workbook and to read it yourself, but to actually become certified with somebody who's been doing it for a long time, and to practice and role play it and then get feedback and kind of have the anxiety of an expert, observing you and giving you feedback really helped me assimilate it compared to just taking a class in grad school. So I'd highly recommend that people look into certification. That's well worth your money.